A stroke is a syndrome of rapid onset neurologic deficit caused by focal cerebral, spinal, or retinal infarction or hemorrhage. The underlying pathology responsible for stroke is either ischemia, hemorrhage, or other rare causes. Here you can see a brain cell, and this is the blood vessel that's bringing blood to the brain cell. The brain cell's energy, nutrition, and oxygenation depends on how good the blood supply is. In an ischemic stroke or infarction, which is the most common type of stroke, what happens is this brain cell is not getting enough blood because they have a block in their blood supplying pathway. The most common cause is due to atherosclerosis. Here you can see that most of the diameter of the blood vessel is occluded by this atheromatous plaque. So this will disturb the normal blood flow, so the cells distant to this plaque will be depleted of oxygen and nutrients that the blood brings. And the same principle applies to thrombus and embolism. They have a block in the road, so the blood can't pass to their destination, which is the cells. Who are the patients at risk of forming an embolism? The patients with rheumatic fever, valvular heart disease, myocardial infarction, arrhythmia, and infective endocarditis. And sometimes, if the path can get narrowed, like in conditions like stenosis, this can also lead to ischemia in the distant tissue. For example, in large artery stenosis. And finally, if there's a systemic problem and the patient just doesn't have enough blood to send to the brain, in situations of severe hypotension, in cardiac arrest, this will lead to border zone infarctions in between the vascular territories. Hemorrhagic strokes. Now let's say that there is a problem with the vascular endothelial wall and it gets ruptured open. The blood that was inside the blood vessel will come out, and this will not only reduce the blood supply to the brain, but the blood that came out of the vessel can cause serious problems like irritate the brain parenchyma and increase intracranial pressure. This is caused by intracerebral hemorrhage, subarachnoid hemorrhage, arteriovenous malformation, aneurysms, hypertension, and anticoagulants. Other rare causes of strokes are arterial dissection, thrombocythemia, polycythemia, and hyperviscosity state, vasculitic causes like systemic lupus erythematosus, polyarteritis, and giant cell arteritis, sympathomimetic drugs like cocaine, and over-the-counter cold remedies which contain vasoconstrictors, and finally, CADASIL, which is cerebral dominant arteriopathy with subcortical infarcts and leukoencephalopathy, and it's a rare inherited cause of stroke and vascular dementia. I hope you guys learned something today, and if you did, please hit the like button and comment your ideas, and subscribe to my channel for more content like this. And as always, thank you for watching. I'll see you on the next video.